Hello, my name is Stacy Barr. I'm a certified oncology data specialist with the Missouri Cancer Registry and Research Center. The objective of this video is to teach physician offices how to report their melanoma cancer cases to the Missouri Cancer Registry. We will do this electronically using WebPlus. WebPlus is developed by the Centers for Disease Control and Prevention. It is a secure web-based application designed for use by physician offices and other low-volume cancer reporters that do not have facility-based cancer registrars. The Missouri Cancer Registry is a collaboration between the Missouri Department of Health and Senior Services and the University of Missouri. We are supported by the Centers for Disease Control and Prevention's National Program of Cancer Registries, or NPCR. The Missouri Cancer Registry collects comprehensive data on all diagnosed cancers in Missouri, required by the mandates outlined in Missouri statutes and regulations. The Health Insurance Portability and Accountability Act, known as HIPAA, allows for the reporting of identifiable cancer data to public health entities. Because the MCR falls under the definition of a public health authority, HIPAA allows your facility to report cancer incidence data in compliance with state statutes and regulations. The CDC's National Program of Cancer Registries requires state central registries to collect incidence data on residents, follow stringent data management procedures, provide training for state personnel, hospital registry, and non-hospital reporting facility staff, conduct case-finding audits at selected facilities, and have legislation in place that mandates reporting of cases by all types of facilities that diagnose and/or treat cancer. The WebPlus login can be found on the Missouri Cancer Registry's website at cancerregistry.missouri.edu. On the WebPlus page of our website, there's an overview and a manual to help you with any questions you may have about WebPlus. Clicking on the WebPlus login button takes you to the WebPlus website. This is a view of what you'll see as the WebPlus login page. Once you've logged in, click on Melanoma Reporting below your clinic's name. Use the tabs along the top to navigate in WebPlus. Clicking Find Open Abstract at the top will take you to a list of complete or incomplete abstracts for your facility. The list can be ordered by status, last name, diagnosis date, etc. by clicking on the column headings. If you ever need to contact us to ask about a specific abstract, please email us with the abstract ref ID number circled below. Please remember not to send any private health information by email. Clicking on New Abstract along the top will bring you to this screen where you can begin a new abstract. Please note the session time in the upper right corner. Press Save regularly in the lower left to save any progress. You can always save and come back to your work later using the Find Open Abstract tab. Begin each abstract with the accession number. This is a unique 9-digit number assigned by your facility. The first 4 numbers specify the year the patient was diagnosed. The following numbers correspond to the consecutive order in which the patient's primary was abstracted by your facility. For example, 2024-00001 would be your first abstracted case for 2024. Clicking in each field causes a help text box to pop up to the right. Please read these to know exactly what is required in each field. All dates are entered as 8-digit numbers, with the first 4 numbers being the year, followed by the month and the day. As you continue to fill in the fields of the abstract, use the drop-down menus by clicking on the blue box drop-down arrow and choosing the appropriate code for each field. Some fields have a magnifying glass icon on the left. Choose the magnifier icon to display a lookup menu for that item. Be sure to fill in the patient's race. State cancer registries are required by NPCR to record race for all cancer patients. The county diagnosis field is a 3-digit county code. The MCR website has a link to a zip code lookup that provides the correct county for each zip code. You can then look up the 3-digit county code by clicking on the magnifying glass icon to the left of the field. To find the zip code lookup, back on the MCR website, click on the Reporting tab at the top of the page and choose Abstracting Resources from the drop-down. Zip code lookup can be found on this page. Going back to our abstract, the date of diagnosis will be the date of the shave or punch biopsy. It is not the date that the path lab returns the results. For the primary site field, click on the magnifying glass icon on the left. In the search box, type skin and then the appropriate site. For instance, skin shoulder or skin knee. Typing skin first will get you the appropriate codes to select from. They should always begin with C44. In the histology field, click on the magnifying glass icon. Type melanoma in the search box first. This will bring up all of the melanoma codes. Then type in superficial spreading, lentigo maligna, or whatever specific histology is stated in the pathology report. If the report only stated melanoma, the code is 8720, melanoma NOS, or not otherwise specified. For the behavior, you will select 2 for an in situ melanoma and 3 for invasive. The tumor size is the size of the neoplasm in millimeters. For instance, a 1.2 centimeter mole would be entered in as 012. This size is found in the clinical or doctor notes. Do not use the size stated in the pathology report, as tissue shrinks in preservative. The last item under cancer identification is the class of case. Class of case refers to your facility's role in this cancer diagnosis. Read through the options in the drop-down menu and choose the most appropriate answer. Did your facility perform the initial biopsy and diagnose the melanoma? This would be a class of case 10. Did your office perform the biopsy as well as the wide excision or Mohs? This would be a class of case 14. Or was the patient diagnosed elsewhere and referred to your facility to perform the wide excision or Mohs? This would be a class of case 21 or 22. Date of first contact is the date the patient was first seen at your facility for this specific primary. So it would be the date of the biopsy if your facility diagnosed the melanoma. If the patient was sent to your facility for wide excision or Mohs, then it would be the date of that procedure. Please be sure to enter the dates correctly with the year first, followed by the month and day. Primary payer, we are looking for the type of insurance the patient used for their visit. For the summary stage field, click on the magnifying glass icon and choose the appropriate code. 0 for an in situ melanoma, 1 for a localized invasive melanoma. In the schema selection fields, click on the first calculator icon and these fields will be populated automatically. However, these fields are dependent on having the correct primary site, skin, and histology, melanoma, coded above. When the schema selection fields populate, the SSDI fields will open. SSDI stands for Site-Specific Data Items. Use the lookups to code these fields appropriately. Breslow thickness is the thickness of the tumor. This is found in the pathology report. In situ melanomas are coded XX.9. The margin width refers to the peripheral surgical margins. This would be found in the physician's operative report of a wide excision or in the physician's statement. Do not use the pathology report to code this item. Enter XX.9 if the doctor hasn't noted the margin width or if wide excision or Mohs wasn't performed. Text fields are important. Clicking in each field pops up a prompt that tells you what we are looking for in each field. Whatever you've coded must be included in text: race, tumor size, specific histology, alcohol or tobacco history, specific primary site, and specific information from the pathology report. Be sure to include dates of all procedures. Please be specific. Primary site, specific histology from the pathology report, where the patient was referred, what surgical treatment was performed, if any, and where that was performed. If you code lentigo maligna 8742 in the histology code field, then you need to write lentigo maligna melanoma in the histology text field. Some things to remember. Write dates in the text boxes for each procedure, test, surgery, or treatment. Be clear about where each surgery or procedure was performed. As an example, if a biopsy was performed at one facility and the wide excision at another, you'd type in the name of each facility in the appropriate text box so we know where each procedure was performed. Text must provide the rationale for selecting the codes assigned to primary site, histology, extent of disease, and treatment fields. Brief, meaningful comments are all it takes to tell us what we need to know. One way to improve your text is to fill in the text fields first, then code fields in your abstract from that information. While it may feel awkward at first, it will show you how important accurate text is to MCR. Enter relevant information to the specific case only. If information is unavailable, state so in the text. Text is evaluated in data quality audits to ensure coding accuracy and completeness. Missing or inadequate text to support the coded fields results in unnecessary errors affecting final statistical results of an audit. Next, we come to the treatment section of the abstract. For the date of diagnostic procedure, you only record a date when there is a small specimen of tissue taken from the melanoma tumor, such as a needle or core biopsy. Shave and punch biopsies are always coded as surgical procedures and not as a diagnostic procedure, so you'd leave this field blank. The diagnostic procedure code is defaulted to 00, saying that there was no diagnostic procedure performed. You would only change this if a needle or core biopsy was performed. Date of first course treatment is the date of the shave excision or punch biopsy. The date of surgery, this is also the date of the shave excision or excisional biopsy. A shave excision is considered part of first course treatment. The date of most definitive surgery, this is the date of the wide excision or Mohs. If all you know is that the patient had a shave excision at your facility, then this is also the date of the shave excision. All three of these fields could have the same date. For surgery of primary site, choose the code for the type of surgery performed to the primary site as part of the first course of treatment. This includes treatment given at all facilities as part of the first course of treatment. As an example, if a patient comes to your facility only for a wide excision, but has already had a shave excision at another facility, code B520, shave excision followed by wide excision. Scope of regional lymph node surgery describes the removal, biopsy, or aspiration of regional lymph nodes at the time of surgery of the primary site or during a separate surgical event at all facilities. For the date of last contact, enter the last date of any communication with this patient. For the cancer status field, enter the cancer status of the patient at the time of last contact. This field is a reflection of the margin status noted in the pathology report. You will choose 1 for no evidence of this tumor, 2 evidence of this tumor, or 9 for unknown. Please remember, complete first course treatment of melanoma is a shave excision, punch biopsy, or other excisional or incisional biopsy, and a wide excision or Mohs surgery. A shave excision alone is only part of first course treatment. If your facility only completes the shave or punch biopsy, the patient hasn't completed first treatment. A shave or excisional biopsy is considered first surgery for melanoma because the intent is to remove the entire neoplasm, even if at the time of the biopsy you aren't aware that it's melanoma. Superficial spreading melanoma is now being referred to as low cumulative sun-damaged melanoma, and you may start seeing this on your path reports. If you forget, helpful prompt messages appear to the right for each field when you click in them. These prompts tell you what we are looking for in each field, give examples, and show the format that's required. Here are some common questions you may have as you get started reporting your cancer cases. What if a patient has two primaries diagnosed? If a patient has two primaries diagnosed at the same time, you will need to fill out separate abstracts for each primary. Unfortunately, the software doesn't allow us to copy the patient demographic information, so that would need to be typed over again into a new abstract. If a neoplasm is noted as being 0.5 by 1 centimeter, what would I enter for the tumor size? You enter the largest measurement of the neoplasm. In this example, the tumor size would be 1.0 centimeters, or entered as 010 in the tumor size field. How do I fill in the date case completed and date case exported fields? The software fills in these dates automatically when the case is completed and exported. When would you like the report? Please wait until the patient has finished treatment at your facility before reporting the case. If a patient comes for a shave excision and will be returning for the wide excision, please wait to complete the report until after the wide excision. If a staff member is leaving your facility and a new person will be taking over cancer reporting for your clinic, please notify MCR so we can set them up with a new user account in WebPlus. Detailed instructions on cancer reporting can be found in the non-hospital reporting pages of our website, where you'll find the non-hospital reporting manual. You can always email to ask questions, bars@missouri.edu. Please remember HIPAA rules and don't send identifying information in your emailed questions. We appreciate your timely, detailed, and accurate reporting as we work together to maintain a statewide cancer surveillance system and participate in research in support of the prevention of cancer and the reduction of the cancer burden among Missouri residents. Thank you.